February is American Heart Month, and we have a cardiologist in the house to discuss the things you need to do right now to make sure you have good heart health. The Health Source podcast starts right now.
You are listening to the Health Source podcast, presented by the Marshall Health Network. Now here's your host, Rick
Welcome
Lord.
inside the Health Source studios here on the campus of Marshall University. This is the Marshall Health Network's Health Source podcast, and we are delighted to be joined by a cardiologist today in what is Heart Month. It's fitting that February, with Valentine's Day right around the corner, is American Heart Month. So he's here today to tell us everything we need to know to make sure that your path stays secure on your path to wellness here on the Health Source podcast. This is Dr. Carlos Rueda. Thank you so much for joining us, sir. By the way, I want to give you some flowers here. You are the region's only board-certified, fellowship-trained heart failure specialist. So we got the right guy in the house today. First of all, just give us a chance to get to know you a little bit. Talk about your background, what brought you to West Virginia, and what got you interested in cardiology.
Yeah, so a little bit about my background. I'm Colombian, I'm South American. So I first initially trained in Colombia, in my country. So I graduated there as a physician. And then my first stop was in Miami. I went to Miami University. I did internal medicine over there. Then I did cardiology at Chicago. And my last training was at Vanderbilt University. That is the biggest transplant center right now actually in the globe. So the numbers that they are doing like close to 124, 125 transplants a year. So that is a huge number compared to the other institutions. And when I was there training, actually they reached 101 transplant when I did my fellowship over there. That was number one, number two, together with Cedars-Sinai. After my training, I came to Marshall University as part of something called a waiver job. So what it is when you have a visa, that is a J1 visa, you have two options. You either go back to your country and you basically develop what you learn in your country, or you can stay in United States and serve United States for at least 3 years, and then you change your status of J1 visa into a working visa. And that's how I end up in Huntington, West Virginia.
How old were you back in Colombia when you realized I'm not going to be a soccer player? I'm gonna go for the set my bar even higher than that and then go for the cardiology. I mean, obviously, which is football down there is still it's a huge thing, right?
Actually, it's funny because I actually wanted to be a soccer player, and so my parents got me into skating, like speed skating,
sure.
And I was actually a national representative of my country.
That's awesome.
In this, I was a national champion as well, state champion in skating. But my parents, I was good at skating, so my parents didn't allow me to play soccer.
Okay.
They put me more into that route, and actually I was very glad that I did that. And then when I finished and I started med school, I have to quit sports.
Sure. Well, but exercise is probably still a big part of the routine. It's a big part of heart health as well, and that's where we want to begin here. If you could, 100%. For us, just give us a Cliff's Notes version and define what you see as heart health.
Yes. So absolutely. I think sports and exercising, like not competitive sports. Competitive sports are actually not healthy.
It's almost too elite.
It's way too much. Yeah. Exactly. It's actually a burden for your body. But doing exercise is actually very good. I personally exercise. I do cyclism. I think that is one of the good ones together with swimming. So basically what is recommended is to do aerobic exercise. What aerobic exercise means is that you can actually have a conversation as we are doing while you do your routine, like while you're walking, while you're jogging.
Treadmill stuff.
Yeah, as soon as you start getting short breath, that is not the healthy heart exercise. And of course, apart from exercise, diet is very important. I think just having the common sense of having a healthy diet, using fruit, vegetables as your main, and protein as your main background for your diet, that is what it matters. Staying away from the addictions, smoking, drinking, maybe partying too much, that will be also good for your heart.
So what is the balance there? I mean, you talk about lifestyle choices and then something like diet and exercise. Is there also maybe a connection between mental health and heart health as well?
Yeah,
So
absolutely.
what would that be?
I think when what we see, especially in heart failure population, there is a huge component of mental health and depression. Close to 20-25% of the people, they are actually depressed. And this is part of the entire, the global treatment of the heart failure, that is making sure that your patients are served in all the areas. Exercise and healthy lifestyle, actually that helps as well with depression. So having a full global treatment for them is quite important.
There's a lot of overlap there too, because
There's a
those are
lot of
some of the
overlap.
things that kind of cycle into mental health, is things like lack of sleep and lack of motivation and not eating right, and so that can compound itself too and lead to heart problems. It's such a huge, obviously, problem, and still the number one killer in America. I mean, the numbers fluctuate each year, but we're talking about close to, in some years, 1 million people dying from heart disease every year, and it seems as though the numbers are going up, but sometimes that's not necessarily a bad thing. That might actually just mean that we're doing a better job of finding it.
Correct.
Is that what you're seeing? Is that maybe detection's become a little bit better?
You are right. So talking about heart failure, for example, what happens is that many people stop dying from other stuff and then they develop heart failure. I think the best example is cancer. So people don't longer die from cancer, breast cancer, for example, and then because of chemotherapy agents and treatments, then in the future they develop heart failure. So it is a good thing and not a good thing in that sense, but we are actually also better at detecting heart failure. Things like this podcast, create awareness to people, so that actually make them go to the doctor and make sure that, some people are so used to just not feeling good that they think that is normal.
It becomes their life, yeah.
It's just a lifestyle for them. One of my patients, like just recently, was telling me, "Oh, I'm feeling fine. I'm not doing anything out of the normal." Like, okay, so how far can you go without getting any shortness of breath? How many blocks can you do? Maybe less than a block. That is very abnormal. But if they don't hear this, they don't go to the doctor.
Yeah, it just becomes part of how they live.
That's their normal.
And what would you say are maybe some other popular misconceptions about heart health?
I think another misconception is that apart from the limitations, is that I have a neighbor that I also have this. This runs in my family, and it might be okay. Or sometimes they hear from other people like, I did this, and it works for them. When it actually is just a popular saying that spreads around faster than actually our words.
And that's got to be a challenge for cardiologists and for medical profession as a whole, because genetics do play such a big role in everything. And in that vein, people have almost their individual health profiles, right? You've heard stories about, my grandma lived to be 105 and she smoked and drank every day. Well,
correct.
That's not normal. It can happen, but those are outlier situations. Exactly. So that's got to be difficult then to create challenges to make sure that everyone has to be treated on their own curve, so to speak.
Absolutely. I think that's what I was referring. Like, people have misconceptions about this,
just
and
because
they think that is good.
Somebody else. Yeah.
So, no, this person has smoked their entire life, never had cancer. Then that person smokes, 3 years later, lung cancer.
Right.
That happens.
So when you're talking about lifestyle changes that people can start making right now, a lot of times that can certainly be helpful. There are other times I would suppose, or maybe medication is the way to go. How do you get to that determination on what would probably work best to begin someone off on a regimen?
I think they need to be hand in hand. You cannot, especially if you already have a diagnosis, then you gotta go lifestyle modification together with medication, and this should not be optional. But this is when you already have a diagnosis. People like maybe myself, I haven't been checking a while, but that I don't have anything, then lifestyle is just the way to go. So we prevent people to be diagnosed. So we actually extend that bracket of getting heart disease. So lifestyle modification for every single one, and people that are diagnosed, treatment.
They say that a lot, that prevention is the best cure, right?
Yes.
Before it even gets to that point. So what if you could give someone maybe one thing to do right now that could start them off if they're like, I'm not really sure, I have a history, I'm okay right now, but I'm concerned. What what can they do right now if you can just do one thing that's easy for them so that they don't burn themselves out on it? What would be that one change that you can make today?
The one change, but it's not the easy one, is eat healthy and lose weight.
Okay.
That's one of the most difficult things.
Sure.
Losing weight is tough. And, many people they try for short time, and they abandon the
Well,
lifetime
we'll talk
of
about
it.
that a little bit because there is certainly a direct correlation between obesity and being overweight and your heart. I mean, people might say, well, this is just the way I am. And there's certainly truth to that. We don't want to discount that. But regardless, there is a direct correlation. Can you talk a little bit about that?
There is. And also, I think one of the ones that we're been battling actually, and we're been very successful was the smoking. I think in the past, the numbers, they were very high. I think we're decreasing the numbers. And now we're going towards different stuff that are also addictive and are not good. But at least smoking, we have seen that is decreasing.
What kind of, when people come to you and they say, this, and people know the obvious symptoms, tingling in the arms or whatever if they were having a heart attack. But maybe with heart health, what are some of the symptoms that often go like ignored most by people that you're like, hey, you should have come in 3 weeks ago if this was happening?
I think in terms of heart failure, one of the most important things is just not being able to do what they used to do before.
Getting tired real quick.
Getting tired real quick. Presenting with lower limb edema or swelling of your legs. I think that is very important, and some people, they take it as normal as well. Like, at the end of the day, I have some swelling when I go to sleep, and then next day, I am better. Well, that is abnormal. That should not be happening. And of course, having the serious symptoms that everybody gets scared, that is chest pressure or feeling discomfort in your chest.
At that point, it's ER time, right?
That is ER time. Yes, exactly. Or something that people also think that is normal and they get used to it is that they start sleeping with more incline. So they start using 1 pillow, 2 pillows, 3 pillows, sitting up to sleep. That is also a sign of heart failure.
It is. And also sleep apnea, which can go hand in hand with heart failure too as well. So is that something you would recommend if people, like there have been times when I'm laying down and a snore will wake me up. I'm like, what's going on? Did I have problems breathing there or something? So I mean, there are sleep doctors out there that can diagnose if you have sleep apnea, maybe put you on a CPAP machine. Have you seen that to be helpful as well?
100%. In my clinic, we screen every single patient with heart failure for sleep apnea. You can have a sleep apnea that is central related or obstructive sleep apnea. That's the one that you snore like. That's the obstructive one. And it's very prevalent, actually. There's so many people that they get diagnosed that they were not diagnosed. As part of the screening, then we treat them. And actually, that is going to help significantly for high blood pressure, cardiovascular risk, and heart failure.
At what point do you start recommending statins for people?
So the statins goes more towards ischemic heart disease and heart attacks and MI. Every single person that has an acute event that goes to your heart, MI, heart attack, then they should be in statins. Then when you do a lipid panel or a lipid profile, and then we calculate your risk, and your risk is significant for the future, then you should be in statins. I remember when I was in training that we were making this joke of, statins should be actually in the water. Everybody should be in a statin. And kind of yes and kind of no, because of course it has side effects. So you gotta be selective for your patients, but it is a medication that we actually have seen significant benefits. So if you have a heart condition like coronary artery disease, definitely you should be. If you have cholesterol issues, definitely you should be in a statin.
Is in your career, have you seen over the last few years any new tests or any new screenings that you're excited about where you see this progressing?
Yeah, so I think we still use the old tools. Okay, so I think the most useful thing is echocardiogram. That is maybe, at least for my area.
They hook all those things up on it? Yeah.
No, that's the one with the ultrasound and the jelly, the ultrasound probe. So you can see the heart function, how the heart contracts and all these things. EKG, that is the one with the stickers, that is very good for detection of the serious heart attacks. So I think the old tools are fantastic. But with the growth of technology, now we have different devices that actually tells you about when are you gonna get sick, even before you get any symptoms. These devices are so sensitive that they get basically alerts 2-3 weeks before you experience any shortness of breath. So technology is growing. There's a lot of new tools. We use them all, and just using the old tools with the new ones, it makes the perfect combination.
There's also a next level test, basically called a stress test, where you put them under a little bit more stress to see. Is there a progression there? Is there something that you see early that you say, okay, you might be a candidate for a stress test? We should probably do this at this point.
Yeah. So when we have somebody that is been complaining of chest pain, chest pressure, and all the symptoms, we classify them in basically cardiac or non-cardiac pain. And this is based just in the typical presentation of a cardiac chest pain. If you have typical or cardiac chest pain, usually we go for the big guns, that is a heart cath, invasive angiography to see your heart arteries. If there is an obstruction, we can fix it with a stent. But people that they are low risk or intermediate risk, then they go for different testing. Like it could be a stress test. That is a way to try to see if there's any occlusions in your heart arteries, or something that we've been using more and more, that is a CT angiography. It's a CT scan with contrast that is dedicated for your arteries and is very, very good now. Very sensitive and is very reliable test. For people that, we're not completely sure, let's make sure that we rule out this. CT scan with angiography is one of a good test.
And a lot of people these days, with the technology the way it is, or have like wearables, things on their wrists or something that can detect their heart rate and are those helpful?
This is for training. I use it for my exercise. There's different ones. I think they are good to get an idea.
Like as a tool.
As a tool. But for us, for doctors, we don't fully rely on this. Okay? I think this is good to, if you're a patient that has issues with heart rate, maybe you can monitor this a little bit to get an idea. But for us as a physician, we use it as a little extra tool, but it's not 100% reliable to actually make decisions based on these monitors.
So if someone comes in and they think that they're having some heart issues and or they're concerned about what's going on and maybe need to start a medicine regimen, what are some of the questions that they should ask before they start medicine?
Yeah. So let me go back to
Sure.
to your question that you just did, so we get it clear for everyone. For example, so if you have a monitor and your monitor is telling you and is detecting that your heart rate is going irregular, so I cannot trust this. But just by you telling me, my monitor said that I was irregular, maybe in an abnormal heart rhythm, then I do another monitor that is like a patch or sticker, right. And in that way I can detect appropriately the arrhythmia. So this is like a alarm triggering device,
sure.
But not a diagnostic test. Yeah. And then your question was?
Well, yeah. So, for instance, like my mother, bless her heart, she's always worried about things when she goes to the doctor, and she's like, "Oh, they want me to start this new medication." I'm like, "Well, trust what they say. That's what they're there for." But a lot of people that might have that kind of apprehension. Are there any questions that they can ask to feel better about what's going on with a new medication?
Yes. I think we need to understand that every single medication has a side effect. Now, is the side effect something that you can tolerate? Is the benefit way bigger than what the side effect could right. bring? And that's where we start. For example, in our case here at Marshall Cardiology, we have pharmacists, we have pharmacy technicians that when patients, they have any doubts, so we bring them to the console, we bring them to the room so they can explain all the side effects, what to expect. And when people know what to expect, they can detect things first, they can feel actually better treated, and they know what they're doing. Right. So if something happens, they are one step ahead.
Is it possible to reverse heart disease, or is this something where you're just trying to slow the progression?
Yeah, I think it comes in different flavors. So we're going to have something that you can cure. There's going to be some other ones that you slow down. And there's going to be some others that you're going to just kind of keep it in cruise control, making sure that there's no further complications about this heart condition. I think one of the good examples, for example, in my area, that is heart failure. So if we see a pregnant patient that develops heart weakness, most of them, they actually recover. Most of them with medical treatment, they don't recur. So we can tell they are cured.
Yeah.
Okay. Another example that they can be cured is when you have a heart arrhythmia and we do a treatment called ablation. That is basically burning the side where the arrhythmia is coming from. And if we fix that arrhythmia area and that area in your heart, then it's very likely that this is not going to happen again. But there's some other conditions, like there's some type of heart failure that we cannot point what's the issue, where it's coming from, what happened. We call it idiopathic. We don't know where it's coming from. Usually those are more cruise control, making sure that nothing else goes wrong, and it's going to be a chronic debilitating condition.
You talked about how important it is to have awareness in February, Heart Health Month. Are you pleased with the way this is going? Do you see heart health getting better? Do you think that we're making a difference here, putting a dent in it as we move forward over the next 5 years? Is there anything happening right now that has you excited about being able to stem the tide, so to speak?
I think we're moving in the right direction. I think there's still a lot of effort that needs to be done. Yeah. I think there's way more education. There's more things that we can do. But at least we're going in the right direction. And if you see the new generations, you see that they are more into exercise, looking better, having a good lifestyle, taking care of themselves. So I think we're moving in the right direction. Are we done with this? Definitely not.
Right. Always goes on.
There's a lot of room for improvement.
I feel like I've been in a class. I learned a lot from you. Thank you so much. Let me see if I got this right. So eating well, exercising, but you're not talking about elite athletes. You're just talking about moderate exercise. Smoking, drinking, bad habits, try to cut those out if you can. Listen to your body, right? And get your screenings and checkups. And if you do all that, you should be in the best position that you possibly can be. And know your family history as well. That's a good one.
Yes, and go to your doctor early. Don't wait. Don't wait until you are way too sick.
Yeah, then it's too late.
Sometimes we have this window that you can actually do something. But when you lose the window, it might be too late. And then we're going to deal just with the complications without dealing with a good heart recovery. So it's better early.
Well, you can add professor then to your list of things to do, along with the soccer and the skating and the cardiologist. You can be Professor Carlos Rueda as well. Thank you so much for your time.
We're working on that.
We appreciate you.
Thank you so much.
We appreciate you as well. Be sure to like and subscribe. We can't do this without your support. Until next time, I'm Rick Lord. Take care.
That was the Health Source Podcast, presented by the Marshall Health Network.